is Dr. Kate Eckert with Form, Function, and Flow Lab. We have offices in Oil City, Pennsylvania and Grove City, Pennsylvania. We haven't done our podcast in a very long time. Previously, it dealt with mostly women's health, pelvic floor issues, pre and postpartum. We still do a ton of that work in the office, but we have added in three pretty amazing therapies that have really given both our pre and postpartum patients and our general patients amazing results that I have not seen similar to in the past. I've been in practice since 2007, so quite a few years. I used to do a lot of myofascial release. I've been an ART practitioner since when I was in school, and that is a myofascial release technique. I've done it since 2004, so quite a long time. And these results from the 3 different therapies that we are now using in the office, we still do muscle work to complement them, but they just get people better so much quicker and with more long-lasting results. One of the biggest things that shockwave therapy, which is one of the therapies we use, is used for and is most researched on is for plantar fasciitis. And that is something that I used to treat just with my hands with some tools like rock blades or similar to Graston tools, gua sha, if you know what that kind of a tool is. We would use cupping, we would use ART to help release the musculature going down into the foot, release the foot where it's at on the sole of the foot, releasing the tarsal tunnel, which is very similar to the carpal tunnel in the hand. Hands and feet really mirror each other and come across certain issues. So sometimes people coming in with what they think is plantar fasciitis is actually tarsal tunnel syndrome. So if you focus on the sole of the foot, and even if you take it one step further and you're working on the calf, if you miss the tarsal tunnel, then you are missing the big irritant of that nerve going into the foot. And it often presents as heel pain, so often misdiagnosed. Again, I used to treat that with my hands, and it would take a long time to fix, if at all, and they'd have to supplement with steroid injections. And the problem with supplementing with steroid injections is that it might give you some pain relief, but it also weakens the ligaments, tendons, it thins out your cartilage, it makes you more likely to tear and have joint issues further down the road. So it is a good pain reliever. It's good to avoid surgery because that's more invasive, but it is going to be more invasive than shockwave therapy and laser therapy that we use in the office. So we treat plantar fasciitis all the time. I would say that most people, we start them with shockwave therapy and then we add in laser therapy if they're, having some issue getting it fully resolved. Something that's really important with doing shockwave therapy is that it needs you to rest for a little bit afterwards. So if you're in a profession or hobbies that require you to be on your feet and kind of abusing them all the time, and you're not able to get that at least 24 hours of rest afterwards, it might take longer. It's not going to not work at all, but it might take longer to see the same results as somebody else who can follow the recommendations. Another thing that I have found is that if you just have plantar fasciitis or tarsal tunnel syndrome, it responds really quickly, maybe even with just shockwave, and it would take probably less than 6 treatments. If you have something complicating it, like a heel spur, it is probably going to take longer. Probably, 10 to 12 visits. That's not the case for everyone. Some people will have much quicker, better results, but I prefer to err on the side of caution. I'd rather have people be pleasantly surprised than let down by a recommendation. With this therapy, it's so hard to tell who is going to have soreness after, who is going to respond really quickly. Some people that feel relief instantly are responding to that breakdown of calcification and increased blood flow that the therapy causes. Other people feel absolutely zero relief for about a month and a half. So they need to do 6 visits to even see that light at the end of the tunnel, because they're responding more to the cell regeneration. And it is a huge part of why the therapy lasts for so long. So, you're having that initial breakdown of calcification, but the cell life cycle takes that 8 to 10 weeks to fully heal. And it almost creates the same response as PRP injections, but those also take a while to see the full effects. It's not instantaneous, it's more of a delayed gratification, and that is often really hard for us to, think we're putting in this time once a week, when is it going to start helping? But really, you can't say if the therapy worked for you or not just by doing it once. It's kind of a waste of money if you only do it one time, because you're not giving it the chance to do those dramatic effects that it does have for people, unfortunately. But it is definitely, depending on your pain level, a great way to return to your activities, get back to walking, running, all of those things that plantar fasciitis really keeps us from doing. And it's much less invasive and better way to do it than with steroid injections. You could just Google shockwave therapy and plantar fasciitis, and you'll find a ton of research on the therapy. The kind of shockwave that we have in our office is ES, and it is more effective. We've tested other machines in the office, and this definitely was the best one that we had tested. So it is more expensive than the other ones out there, but there's a reason for it. It's less painful, more effective, more long lasting. We always have people try the vibration plate after their therapy appointments, because with the breakdown of calcification, you're dumping that into your lymph system. So we want to get rid of it, and the lymph system needs to be moving well to do that. So if you have a very sedentary lifestyle or something like that, it is going to lend itself to a stagnant lymph system. It's going to make you more inflamed overall. It affects how you feel, all of those things. So using vibration therapy is a way to get your lymph system to move better, and we really encourage that for people. Some people don't like how it feels, and we don't force you to do it, but it is definitely recommended. And it also helps with proprioception in the ankles, knees, hips as you're standing on the vibration plate. So it has a lot of good benefits. For our patients that have osteoporosis, we turn it up past 20 hertz. And if you're above 20 hertz, it also helps with bone density. So lots of good benefits from doing the vibration therapy afterwards. We also have patients do exercises at home, which are so important to keep the mobility going that we created for you in your treatment. So it's like a series for the perfect storm of getting those feet back to what you want them to be. So your therapy in the office, the vibration afterwards, we give you some nutritional recommendations. We have you do exercises on your own, and we even recommend getting your own little vibration tool to use on your feet at home. That's up to you though. And that has been pretty successful. I can only think of like a few cases that we have not had success with for plantar fasciitis. So it's very heavily researched, excellent therapy for that condition. And if you have any questions or anything like that, you can let us know. It's also even helpful if you have a heel spur to bring in your imaging, and we can direct the shockwave for part of it directly at the heel spur so that we can create the most significant change to that area. So if you have any questions, let me know.